Hello, and welcome to Facebook Live with Dr. Brie. I am here with reflections on 8 years in direct primary care. And I have to say that it's been awesome. I'm feeling super grateful. I have a conference on Friday and Saturday with Hint Health, and they were part of the original foundation of my motivation in direct primary care. In fact, I did a direct primary care boot camp when I was working in the corporate model. And then I thought after the webinar and series, I thought, I can do this. This is something I can do. I can do it differently. And I just wanted to give my newfangled ideas about having a clinic that was patient-centered, cost-conscious, and, really creative expression of all the integrative and holistic medicine and osteopathy that I wanted to bring to the care that I went to school for. I really felt like I couldn't do that in the corporate model. And when I did Hint Health's, boot camp on direct primary care, I thought, oh, it doesn't have to be concierge care. I don't have to work with just rich people. I can work with anyone. I can make this cost conscious. I can make this doable. And so I did. And I found this little office. It's so cute. It's by Lakeside, this silly little amusement park in Lake. I went and looked at offices with my kiddos on my days off, and the whole thing just kind of grew from the ground up. And it was what I called my third baby. My third baby's about to turn 8, still very much in elementary school still, but that's okay. And there have been some, anticipated wins. So I would say one of the anticipated wins that I've had has been that we have always been able to have the relationship with the patient as the primary goal. So that's been this way the whole time. I can still recognize one of my patients from the waiting room by their voice or their cough or how they interact with people when they come in. It's really a great benefit that we've had relationships now with people for 7 to 10 years. And in my panel, people came over from the previous clinic. Some people even came over from residency. I hope to see a lot of you people, you know who you are, at the party on Thursday from 5 to 7 p.m. It's this Thursday, the 26th. I'm super excited to share my gratitude and appreciation with everyone, including, what we like to call our foundational members. So I'm grateful that those relationships have really been able to thrive in this setting. There's really nothing like having a 45-minute visit with somebody in an hour if you need it. We have our wellness visits set up for that long. We put longer time on patients who need it. And we're always able to really dive in. I'm able to actually do what is my skill set and saying, I know that this is the complaint, but let's dive a little deeper. What else is going on here? What else can we unpack? Can't do that in 7 minutes. Or you can't do that when you're double and triple booked like it happens in the corporate world. So that, of course, is an anticipated win, that the relationships in this model have deepened and really are what make me a family doctor. That's what I went into it for sure. Having more time, that's an obvious anticipated win. And then, being a cost-conscious healthcare advocate in the city of Denver has actually gotten easier and easier. I don't know if I'm just getting good at it. I know where the cheapest MRIs are, the cheapest mammograms, it's like almost October. It's time to get your most affordable mammogram in the city if you're self-pay. I also think that the world has gotten a little easier for self-pay patients and people who are willing to have a high deductible but pay out of pocket for the things that they don't need to involve their insurance in. Those types of things have gotten a little easier. Like our lab panels are so cheap. So it's been really helpful to have that evolution. It's just I think we're just more practiced at it, but it's also our patients sometimes are great advocates for themselves, and they'll teach us, oh, did you know it's even cheaper to do, this mammogram over here instead of over there? Like, oh, okay, great. So that's been an anticipated win. And then, of course, I still have, after all these years practicing in the city, this amazing referral network. I just got off the phone with a specialist. That's why I'm a little late to our Facebook Live today, but calling and speaking about a patient who's near and dear to me, who I want to refer, just making sure it's the right fit, making sure their symptoms line up with what's in that specialist bucket. I cannot tell our referring providers how important you are to us, whether you're a naturopath or a physical therapist. in our network, whether you're a specialist, whether it takes months and months to see you, or if somebody can get in right away. I'm just so incredibly thankful for the referral network that we have had this whole time in the city. And whether you're using insurance or self-pay, we have specialists that are willing to give you, their best input on your case, and to involve us in the conversation, which I could not be more grateful for. Sorry, I know members sometimes they make you run all over the city for those amazing people, but that is an anticipated win that has continued in this setting. The unanticipated wins have been fun and different. I mean, I didn't expect a global pandemic. That was not on my life list. If I could go back and erase like that whole entire experience from the world and my practice of medicine, I would, but obviously I can't. So I have to say that being in this setting in a direct primary care clinic during the pandemic was incredible because I had the control to keep our staff safe, our members safe. We were able to pivot just, to telehealth during the closure. We were able to, really adjust and keep adjusting. I remember when, I worked corporate or even academic, it was like there's so many institutions involved in decisions that decisions just were painful and slow and difficult. And what I see out there now in the larger healthcare world, not just here in Colorado, but unfortunately all over this country, it's just an epidemic of burnout. I mean, providers are burnout, patients are burnout, people are exhausted. People have been so stressed for so long. They moved into these emergency coping skills during the pandemic. They never got out of it. Now people are dealing with, pre-diabetes when they never were before, weight gain they never had before, like literally adrenal burnout and fatigue, caregiver fatigue. It's pretty impressive. I don't think I've ever seen anything of burnout that's happening both on patients and providers. And it's sad because it impacts, our members when they go to the emergency room, the care that they give and how thorough it is and how much people listen at other offices. And I know it's not related, to individual caregivers, but it's really related to a bigger picture of constantly being squeezed from all sides. I know that, there's a book out there on moral injury. I'll put a link in the comments, and it's just so good. I mean, it's really sad that that's out there and it's happening, and it's not better yet. So that was an unanticipated win, is that we were able to prevent a lot of that caregiver fatigue and caregiver burnout. We were able to pivot and meet the needs of our clients. And then out of that came this amazing ability to bring forward our programs in our Healing Pathways programs and really refine and fine tune as we were learning and we were seeing new things, how to actually take those deeper dives and continue our own education. I think without that creativity to fill my cup, I might have been more fatigued as a provider and may not have filled my own cup back up enough to be able to provide the excellent care that we do. But being able to put my energy into writing brain health and really diving deep into what does it mean to have brain fog and where does it come from and how do we make it better, whether it's from menopause or stress or mental health or COVID or long COVID, how do we actually drill down on that kind of, symptom that Western medicine's like brain fog. Okay, well, too bad. See you later. Bye. It's not a stroke. So, can't help you. Being able to come into that space with new tools and new techniques, that has been an unanticipated win. We have healthy living for all the people who have gained the extra weight during COVID and can't lose it, or are going through menopause and are so frustrated with their body changes. Kat stepped up to the plate and said, I can take healthy living and make it a whole new support level for people who are up against these big challenges that we have seen and use them in the new tools. I mean, that's been so cool. Plus, of course, we've always done hormone work, and being able to continue to ride the, fallout of the Women's Health Initiative and change our paradigm, actually listening to women's stories and listening to their experiences with perimenopause and menopause, and then being able to offer bioidentical hormone replacement that's safe and gentle, not only to women, but to men who are going through their own hormonal changes. That's something that, again, I never could do in corporate medicine. I always had to refer out because it takes so much time and it takes a lot more expertise, and there's no training in it. So you have to actually get education and continue your education and those are things that, again, I could not have done in a corporate practice that I do now every day. Diving deeper on heart health. How do we look at heart health from different perspectives? How do we understand a bigger picture that's beyond a cholesterol number? That, again, it all takes time. It takes time, it takes expertise, and those are things that I just didn't have, couldn't put in the plate when I was squeezed between, you know, billing insurance as high as possible and, spending as little time with patients as I could because, the churn was just, is just fast. It was rapid fire all the time. So that's been an unanticipated bonus, and in really understanding that we are able to solve things that the corporate world is not able to solve. People can get into our clinic, they can establish as new patients pretty quickly. We are doing a cap right now just so that we can keep our cough and cold season demand available, because we always see patients same day or next day during this season when people are sick. We have a rapid PCR now, thanks to COVID. We can actually do what used to be like a $1,500 respiratory panel in the hospital that only the emergency rooms could do. We can now do that 15 minutes in the office, and it can tell us with 99% accuracy, 98% accuracy that somebody has a virus or has a bacteria, because it tests 15 different targets in 15 minutes. It's amazing. So that was a nice perk of the pandemic. Thanks for that, COVID. And thanks for the telehealth. I mean, the expansion of telehealth and video visits has been a game changer, just like work from home has been a game changer for people in the corporate world. So those are unanticipated benefits of being in direct primary care for 8 years. We'll open up our panel again. We have a wait list now. We have actively been looking to expand to other providers. But what's been beautiful about this model is that I can really sit with the vision that I started. Had a great business coach, you know who you are, who helped us write this vision back in 2018, pre-pandemic, but you'll notice this is a wave to go with the flow. I made this for myself in 2021 after COVID because there was a lot of surfing. But the vision is still the same. Re-envision health care, health plus care. As an osteopath, I truly want to support your health, provide service, which has always been my goal in medicine, and model balance. So I asked my daughter today, hey, what do you think I should say about, 8 years in direct primary care? There's no big man involved, which is true. Thanks for that, Fiona. And she said, and you can be creative with your patients, and it's so personalized. I said, hey, it's perfect. That's exactly what I'm going to say. So thank you. Thank you to our members. Thank you to our current members. Thank you to our future members. When we do have the next person on our team, probably January, we'll reopen to new members and we'll make it possible to continue to let direct primary care grow and grow. That's the other piece that I didn't anticipate, is how popular direct primary care would be here in Colorado. I have friends opening practices all the time. We are so grateful to be in the Nextera network for people who get direct primary care through their employer. If you're a small business owner, you should definitely look at expanding and adding direct primary care, because your members, your patients, your employees, they will reduce your costs, number one, and they'll have a much better experience and they'll actually return to work faster. Besides like going to urgent cares all the time, or like waiting weeks and weeks to get in, or having complicated things evaluated in an efficient manner. I mean, it's really priceless. So I'm grateful to be in direct primary care 8 years. Come to our party on Thursday. Can't wait to see you. Bye.